Shaking hands or hand tremors may be the first signs of a serious illness, including an overactive thyroid or Parkinson's disease. Trembling hands may be an early sign of an overactive thyroid. It is important to diagnose this disease as early as possible. It can injure the heart. The tremor of an overactive thyroid is usually very fine and hard to see, but it can be made evident by a simple test. Extend your arms with the palms of your hands up and place a sheet of paper on one of the hands. Shaking of the hand becomes quite evident. Other symptoms of an overactive thyroid are intolerance to heat, sweating, and weakness. Shaking hands are called hand tremors. You can also have tremors of the head, arms and legs together, or they can be localized to only the head or one arm or leg. They may be fine and barely noticeable, or they may be coarse and shake the coffee out of a cup. They may also get worse with attempts at coordinated movements, such as touching the tip of your nose with your index finger. That is, the closer your finger gets to your nose, the worse the tremor gets. Also, it is more apparent when you try to sign your name. Most of these tremors are probably inherited, but appear later in life. Parkinson's disease also causes a tremor as well as muscle rigidity, which is much more disabling because it impedes movement. The tremor is expressed as though you are rolling a pill between your fingers at rest. It is accompanied by an expressionless face and stooping shoulders with a shuffling walk. Parkinson's disease is a brain disorder in which excessive nerve impulses flow from the brain. In senior citizens, Parkinson's-like disorders are usually caused by multiple small strokes. The most common cause of tremors in the young is substance abuse, but you do not have to be an alcoholic or on crack or cocaine to develop tremors. Often this scenario involves a busy young executive under stress, working long hours, drinking too much coffee, then drinking 3 or 4 scotch and sodas every night to wind down, and/or heavily smoking. This person begins to notice shaking hands in the mornings. The shaking signals the beginning of dependency on the substance, and it first appears when one stops the drinking or smoking. It is a toxic effect on the central nervous system. Often it gets worse if the person does not stop drinking or smoking. Certain prescription drugs can also cause tremors. Strong tranquilizers cause them so often that additional medicines may be necessary to prevent the tremors. For example, one of the commonly used medications for certain stomach disorders, called Reglan or metoclopramide, can cause tremors, even a full-blown Parkinson's-like disorder. It clears very slowly when the medication is stopped. It is important to seek medical evaluation early to determine the cause of your tremor, since treatment may prevent serious additional complications from the underlying problem.